Good afternoon. Thank you for joining us. We know that there's a lot of questions and a great deal of interest about vaccines. And although our case numbers remain high, the strain on our healthcare system has not abated, and the number of COVID deaths continue to climb, there is reason for optimism because we are talking about the distribution of vaccines. But as we talk about the distribution of vaccines and there's reason for optimism, there's a need for realism about the number of vaccines available, along with some of the challenges associated with getting those out. And so I think it's very important that we be very honest and very transparent about the excitement and the tremendous amount of work that's being put into doing everything we can to get them out there. But also, again, being very realistic with the public about how many are here and some of the challenges associated with ramping up vaccine distribution if and when we begin to get significant numbers. Today I'm going to walk through our efforts as a county and our plans as we roll through the rest of January and particularly heading into February for how we plan to significantly accelerate our vaccine distribution system in San Diego County, both what we as a county government will do, what our partners out there will do, along with what we can do collaboratively and working together. As a county government, we're preparing to spend up to $100 million on efforts around vaccine distribution. This is a significant investment, funds we hope to get reimbursed at some point, but we want to do whatever it takes to do everything possible to get as many vaccines in as many arms as quickly as we can. And in a minute, I'm going to walk you through what some of those plans are as it relates to pods and super stations and partnerships and other efforts. Along with some goals we have, some timelines that we hope to meet and perhaps surpass. I will also share our updated dashboard, a dashboard that we will be updating weekly, and also put in context what that information means. But throughout this, there are tremendous challenges with vaccine distribution. We are going to fight and overpower and overcome and work through and around each and every one of these obstacles. But it's vital that the public understand the situation that we're facing. We know that today there are a lot of questions that the state of California has opened up vaccines for those 65 and older. The total number of vaccines that we are aware of that have arrived in San Diego County is just north of 200,000, and we'll show that in the dashboard in a minute. But the number of San Diegans who are in Tier 1A is 620,000. It also takes 2 doses for any of those people to be fully vaccinated. And so we were just beginning the process of getting through Tier 1A with healthcare workers, and we had a long way to go based on the vaccines that were available. And then today the state announced they're opening up to 65 and older. There are approximately 500,000 San Diegans that are 65 and older. If you add those 2 categories together, you can see that that is well over 1 million people that are being told they are now eligible for a vaccine that no county in California has available to give them. And I think it is important context that we put in that we need people to be exceedingly patient, not because people aren't doing everything they can to get the vaccines out, but because the vaccines have simply not arrived in significant quantities to be able to administer to those. We expect more vaccines to arrive soon, but we don't know when, and we don't know how many, we don't know which ones. And so out of that uncertainty, we are trying to build out systems so we are ready to move swiftly as they arrive in whatever quantity they arrive, but we cannot predict. A common question is, when will I be able to get it, and I'm this age or this category, and the simple reality is we can't predict that because we cannot predict when the vaccines will arrive. As a county, we've also yet to receive a dime of funding, state or federal funding, to plan for vaccine distribution, to prepare for vaccine distribution, or to execute vaccine distribution. Now, we are not letting that hold us up. We are spending significant sums of money to ramp up our efforts and do everything possible to provide the venue for folks, but we are not waiting on those funds to arrive. We're taking a leap of faith. We're going to hold on to our receipts and hope that the reimbursements will come. But again, that can present a challenge, one that we're overcoming. And then for months, we've talked about the critical shortage of healthcare workers. There is tremendous strain on our healthcare system, our nurses, our doctors, all of those folks are incredibly overtaxed and overworked. And so when you talk about standing up mass vaccination centers throughout the county, that requires healthcare workers. And that, again, it presents a challenge, one that we are working around. We will be making some modest changes to our testing, maybe a slight dip in some of those numbers to take some of those public health nurses for vaccination sites, along with doing everything we can to get volunteers. I want to reiterate, if you are a healthcare worker who might be eligible to administer vaccines and you have some volunteer time, please go to healthcarevolunteers.ca.gov. And none of those things I just outlined is in any way an excuse, it's just the reality. And we want to set the expectation and the understanding that it's great that the state said, hey, folks 65 and older are eligible to get vaccines, but that requires counties to actually have the vaccines to be able to give to those folks. For our county run pods and our individual superstation that is up, we will at this point continue to work through healthcare workers. We hope in the near future to be able to expand that to seniors 65 and older, but we have not finished our healthcare workers, and we're going to continue to work through those. Our healthcare systems will have the ability, if they have the vaccines and they're able to administer those to those 65 and over, but I would strongly encourage the public to not have everyone immediately call your healthcare provider today, because it's highly unlikely they have sufficient quantities nor the staffing and ability to do mass vaccinations. My sense is as they are ready and have those eligible, they will be communicating with folks. And again, we will continue to do everything possible to move through this. I do want to quickly walk you through some of the plans that we have in place and share with you where we are headed and what we're trying to build out as a county to make the investment in getting this through. I know some will say it is too ambitious with too many things moving too fast, but I think it's important as a county that we set an incredibly high bar and we strive to try and meet it, and that we are willing to make that investment. A couple pieces of it, which you will see, is the concept of the vaccination superstation. The one at Petco Park has informed a lot, has shown us a lot. You do have the ability to get high numbers of folks through one site. It requires tremendous staffing and coordination and planning, but it is doable. And we plan to go from one of these to 4 of these. Our plan is in early February to open our second vaccine superstation in the South Bay area in early February, and then also in February to open similar type functions in East County and North County. We're working on locations, we're working on planning, we're working on securing all of the things that need to go into those, but we want to build out and have 4 countywide vaccine superstations that will be available to the public based on the tiering and the criteria we were in at the time. We presently have 4 smaller pods, points of distribution centers. These are placed throughout our county consistent with our Healthy Places Index, and these are also operating daily and providing vaccinations right now, again, to healthcare workers. We want to expand that from 4 to 12. Again, countywide, all of those, both superstations and pods, will be eligible to, folks can sign up for via a new portal that will be similar to the one we're using for Petco Park, but will integrate all of the various options, and we hope that that will be live in the coming weeks. In addition to that, we're going to continue to work with our partners to help them. Healthcare systems are administering vaccines on their own. We've already begun partnering with some of our healthcare systems about standing up pods at their facilities. Again, this will be higher throughput and higher volume, and we hope to do that with all of our healthcare partners. We want to work with the cities in San Diego to, again, if the city has the ability to find a site and a location, we can provide some funding and help to try and do that. And the VA, our pharmacies, which are doing skilled nursing facilities, and the Department of Defense will all continue with their efforts independent of what we are doing. Our goal is to complete 250,000 vaccinations by the end of January, and then starting February 1st to be able to administer almost 24,000 doses a day every single day, so we can reach our goal of 70% of the San Diego population age 16 and over by the end of June. But again, all of that is dependent upon the arrival of the vaccines, something that is completely and totally outside of our control. Let me walk you through a couple slides that will show graphically some of the things that we just discussed, and we will walk through these. The first one here is just a breakdown of the basic goal. You see there the San Diego County population just over 3.3 million residents. The vaccine is presently only available for those 16 and older, and so that drops us down to just under 2.7 million residents. CDC and CDPH goal is to get 70% of your county vaccinated for these folks that are eligible. So 70% of those 16 and older would be 1.882 million residents. Each of those folks need 2 shots, a first and a second dose. And so doing the math on that, starting February 1st, we would need to do 23,434 vaccines every single day, 7 days a week, for about 150 consecutive days. If we were able to do that, if the vaccines arrived, if things went according to plan, then we would complete that process by the end of June. Now, a lot can change between now and then. We're sharing with you what we know, what we think, what we're planning for, but there are a lot of variables, including many that are outside of our control. But this is guiding our efforts around the vaccine process. Now, what are all of the various methods we will use? You can see that here on the next chart, which is essentially our vaccine ecosystem. We are going to drive as best we can with what we control to make sure we meet health equity, hitting those communities hardest hit, making sure it's available to them first, accessibility and convenience. What you see here at the top is the county-hosted vaccine events. These are the 4 pods we presently have up and running, 1 in each region in the county. We want to expand that to 12 to make it more convenient, more accessible, and be able to place it in communities that need it most. The vaccine superstation sites, we have the 1 right now operating at Petco. We want to, as I mentioned, grow that to 4 different sites. The next one opening in South Bay in early February, and then East County and North County, again, opening those in February, and we would run those 7 days a week. Our mobile vaccination teams will be those that are going out and doing long-term care facilities, going out mobily and administering vaccines, along with some of our more rural communities, farm workers, and other places that probably wouldn't be able to get to another site. Hospital-based vaccination sites, again, our hospitals are doing their own vaccinations for folks inside their buildings, but we are working with them to build out pods. And we're willing to do that with every one of our healthcare partners in San Diego County so that they can increase the throughput and the numbers that they can do. We are also working with our clinics. Again, our clinics will have some ability to administer them on their own, and if we can help with funding, with resources, with efforts to increase that, we want to do that. City partnerships, we're working with a number of the 18 incorporated cities right now where the city might have a location. They might be able to provide a little bit of staffing help. We can provide some funds, some technical assistance, and stand up additional pods. And again, the aim on these pods is they would be accessible via a single portal, but folks have other entry points in to get it, not just restricted to that. And then, of course, the Department of Defense is receiving and administering their vaccines separate and independent from us, as is the Veterans Administration, the VA. There's a significantly large number of San Diegans who are either active duty or veteran, dependent civilian contractors, and we expect these numbers will, again, help us in our effort to try and achieve these goals. And then, of course, pharmacies, what they will do both in retail pharmacies and then their tasking from the federal government around skilled nursing facilities. When we look a little bit more in depth at each one of these ecosystem components, you'll see here on the next chart, you'll see again, these are just some estimates. And so this is a planning document and sharing with you what we're doing. County-hosted vaccine events, again, these are the 4 pods we have up right now. Obviously, we want to grow it to 12. You can see what we're doing today, and you can see the goal by February of 2021 if we get those up and running. We also have County Fire. We are working with them a lot on Operation Collaboration, doing vaccine events surrounding that. We think that can scale. Our superstation, you see right there, 4,000 doses a day. We think it'll be up to 5,000 doses a day by the end of the week. And again, in February, we want to expand that in early February to 2, and then adding 3 and 4, and that'll bring in a significant number of doses. Our paramedic mobile vaccination teams, again, these are going out and doing long-term care facilities, rural areas, farm workers, other places where they just won't be able to get to another site, and we don't know what those numbers will look like. We know what we're doing now, and we know that it will increase significantly. Our mobile vaccination teams. Then you see our health system and county partnerships. These are the pods we stand up in conjunction with the health system. Right now, we're doing about 1,500 a day in partnership with Rady and with Sharp, but we're in conversations with most, but not all, other healthcare systems about doing more of these. And then health system member vaccinations. This is what our health systems do on their own. And again, as we get more insight into those numbers, we will update those. Same true on federally qualified health centers. We want to partner with them. City partnerships. Other county partnerships, this is an important point to note. We're working with entities like Champions for Health, San Diego Medical Society, along with an entity known as HEAL, where once we have enough vaccines and they're set up, they will be able to go out and administer vaccines to homebound seniors, seniors who don't have the option to leave their house to go to a hospital or a pod. And so there's a number of other county partnerships that will be very targeted and focused. And then, of course, military and Veterans Affairs, the federal pharmacy program, and other pharmacies who are there. In order to make this work as best we can, understanding it's fragmented with a lot of entry points, we are looking for a clinical management system, one where the public can go, determine eligibility, appointments, notifications, and all of the information. What you see here is a screenshot of what we think this type of system would look like. We are working with the California Department of Public Health that will be rolling this out, and we will be an early adopter, a pilot project, one of the very few counties that's selected to go early, and we expect this hopefully in the coming week, that this will be up and running. I know this will alleviate tremendous anxiety by giving people the opportunity to register, assess their eligibility, and then when they are eligible, be able to schedule appointments along with getting notifications, and we hope the system will come up soon. The last chart on vaccines I want to share is just the current dashboard, and I want to make sure that we put this in some context. The 241,825 is the total doses shipped to the region that we are aware of. Again, there are some entities that get them direct from the federal government and other places, but this is what we are presently aware of. The second number there is the number of doses, again, that we are aware have been administered, but it is really important and vitally important that folks understand there is a significant lag between when a vaccine is administered and put in someone's arm and when they're able to catch up all the paperwork and upload it in the San Diego Immunization Registry. There's some times where it may be several weeks after the vaccine administered before it is uploaded into the system. And so what we know of today, based on San Diego Immunization Registry, is almost 80,000 first doses, almost 13,000 second doses, for a total of 92,305. We know the number is much higher, but again, because of that lag and that delay, it is going to take time for this to catch up. And so we will provide you the information as we get it, and we're going to do everything we can to help entities have some help and support so they can get it entered into quickly. But a lot of folks are focused on getting the vaccinations out and then catching up the paperwork component of it when they can. So again, we will continue to work through this. And then the bottom one is just the percentage of our population, 16 and older, who are fully immunized, and that gives us some sense of how far we have to go and how much work is left. Dr. McDonald and Dr. Wooten are both here, and I know there will be a lot of questions about this, and they're here to answer those questions in just a minute when we get to them. But we wanted to walk you through the situation we face along with what we're planning and where we're trying to go. Real quick, I'll run just through our regular numbers. Today, again, here you can see the last 7 days of cases. We're reporting 3,261 out of 14,000 tests performed. Pretty high percentage of positive. And again, our cases, individual days don't matter, but we still are running in that more than 3,000 range. Hospitalizations, you'll see on the next chart, again, continue to climb. 425 related ICU COVID patients, 1,804 total COVID-related hospitalizations. And again, it's modest increases, but we have not seen a decline of hospitalizations yet. And then this next chart you'll see is our ICU capacity, 425 COVID-related patients, 246 other patients. That 33 number on the top of the box there is staffed and immediately available. That includes both adult ICU and pediatric ICU beds. The state does not count the pediatric beds in their totals, but it is an ICU bed in the region, so we want to make it available. And then the final chart here is just the deaths. Today we're reporting 54 additional COVID deaths on top of the 41 from yesterday, which brings us to 1,952. And we extend our deepest condolences to all of those families. Supervisor Vargas is going to give us an update on a couple of issues, including some recent board actions. And then we will get to your questions, and our public health doctors are here and ready to answer any questions that you may have about any aspects of COVID-19. So at this point, I'll turn it over to Supervisor Nora Vargas.